Thanks everyone for being here today. This is something, this conversation is something that's near and dear to my heart. Um, my name is Kimberly Ramsbottom, and I am the Outreach Program Coordinator here at Hospice Northwest. I've been here for going on 4 years, I guess, and I really have come to appreciate the importance of advanced care planning and healthcare consent through the work that I do with individuals as well as clients, as well as in my personal life. So I'm very, very happy to be here and to talk about this conversation. Um, what I'd like to do is hand it over to Kathleen Busso. She is also my partner in crime here today. And Kathleen, if you'd like to introduce yourself.
Sure. Hi, I'm Kathleen Busso. I'm the communications coordinator for Hospice Northwest. I've been with the organization for about 17 years, coming up in September, in July, I guess. So I really enjoy working for this organization, and one of the things that I get to do is help coordinate our dialogues, which are a series of discussion groups that we offer to the community to come together and talk about meaningful topics around end of life or life and death, and just get that stigma of talking about death and dying a little less uncomfortable for people. Because as we know, we're all gonna die. Life is got an end, and so it's good to talk about it, and that's why advanced care planning is so important. So Don't Duck the Conversation is a workbook that we created over the years. I was part of that creation, and it's a helpful workbook that people can use to write down important information about their life, so that you're passing on that information to others at the end of your life. And it could be about your children or your pets, or how to service your furnace, or what your wishes are for your funeral, those kinds of things. So lots of opportunity in that book to write down passwords and all the important things that you might not think about, to kind of guide you through all of those steps. We have that book available here in the office in a hard copy form, and we also have them available on our website in a downloadable version. So if you're interested in getting a copy, you can call me at Hospice Northwest 626-5573, and we can arrange to get you a copy. And that's it for me. So I'll hand it back over to Kim.
Thanks so much, Kathleen. We're both from Hospice Northwest. This is a grassroots organization that we are volunteer-based. We do a lot of work in the Thunder Bay area and region. We try to help people go through their end-of-life journey with as much support as possible, whether that's a support from a volunteer, caregiver workshops that we do, grief and loss support, support in end of life, and a serious illness. And I think we don't often have a lot of conversations around what does that look like for individuals and their families as they're walking through a serious illness. I'm a social worker by background, and my role here is to really support people at end of life, but also through supporting people through education around advanced care planning and healthcare consent. It's important to have this knowledge as we're trying to navigate the healthcare system, and what does that look like for individuals, especially around these hard conversations that we need to have. And like Kathleen said, 100% of us are going to die. So how are we going to attempt to have these conversations, or how are we going to prepare our loved ones for what is to come? So Kathleen was talking about this Don't Duck the Conversation booklet. It's a wonderful, wonderful resource. It was a resource that was developed here at Hospice Northwest. I cannot say enough about this resource. I have worked through it with some of my clients, and in my own personal experience with my sister when she was diagnosed with cancer. We worked through this booklet. It was such a gift to us because it helped us have hard conversations that we needed to have. It gave us kind of an instrument in to have those conversations. We worked through this booklet and it helped us prepare for what was coming. And we were left with all the information we needed to get through her death. It helped guide us and helped us with all that information we needed to know from, like Kathleen said, right? Passwords to shutting her accounts down. Often, after the death of someone, if you don't have a legacy put into Facebook, you'll get notifications from Facebook if the account's not shut down, right? So we were able to get all those passwords that were really important to shut those accounts down that needed to be shut down, even right from that to what she wanted at her funeral service and even who she wanted there. So we were well prepared, at a very hard time in our journey. Because we had all those important conversations. I cannot say enough about this great resource. And it definitely does cross, legislation. So across Ontario, across Canada, you could definitely use this booklet. Some advanced care planning legislation is specific to Ontario, but that's advanced care planning. This is Don't Duck the Conversation booklet, has all this great information about all the things that we need to know, even, where you grew up, where you came from, family history, where you went to school, all those great things, right? So if even when the time comes and we want to think about the eulogy, we can look at this booklet and get all this great information about the individuals that we're working with. Or even if we're doing it ourselves, this is such a gift to your family and to your loved ones. Death anxiety. Often, cultural beliefs are one way we manage the terror, is that's always under the surface, right? That death anxiety. When our cultural beliefs are intact and not threatened, they provide a buffer to understanding ourselves as impermanent. But when people are reminded of their mortality, they react positively to ideas and people who validate their worldviews, but also negatively, right, to people who oppose them. So think of 9/11 or even COVID, even wearing face masks, right? Some people were against them, some people were for them, and some people still wear them, right? So there's a lot of anxiety around, illness. And we may see this death anxiety from people who are suffering from serious illness and life-limiting illnesses. And throughout the progression of their disease, they might worry about, the past and present and future losses that they're going to experience. And leaving loved ones behind are very big factors in death anxiety, right? What is this going to mean for my family? How is my family going to be affected? And what about the role that you leave in the family? For me, losing my children is often in the back of my mind. So that's something that's often, I don't even, when people say, you do want to, talk about it, it's something, it's hard for even me to bring up the conversation. And I work in this daily, and I have these conversations daily. But when it comes to my own personal life, right, sometimes it's hard to have that conversation. So what is advanced care planning? And, I often hear this. Advanced Care Planning Day is on April 16th. It's National Advanced Care Planning Day. So I hope you're all able to do something specific around advanced care planning for yourself. But it's really a process of reflection and conversation, and communicating your wishes, whether that's written, verbal, otherwise, however you want to communicate those wishes, that you're communicating them with individuals who would help make decisions based on your best interest in the event you were unable to speak for yourself. So it's a way to let others know about your future health and personal care wishes and prepare them, right? A consideration of who you'd like to speak for yourself. So thinking about who would I want to speak for myself if I was unable to speak for myself in healthcare. So if we think about, there's all these things that can happen. Anything can happen at any given moment. I can leave here from work today and I can get into my vehicle. I could get into a car accident. I'm in that car accident. I'm not able to speak for myself. I'm at the hospital. They need to do stuff. They need to do treatments. They don't know what I'd want or what I wouldn't want. Who would be my spokesperson, right? So in the event you're incapable and you're not capable of speaking for yourself, and may also give someone you trust information and authority to act on those wishes. So in Ontario, that person is called a substitute decision maker. If you're across Canada, sometimes it's called a health proxy. Or in the States, sometimes it's called a surrogate decision maker. It's really about identifying who that substitute decision maker is and giving them all the information that they would need to make decisions based on your best interest. So that's really the two main points of advanced care planning, right? In Ontario, advanced care planning is identifying who your substitute decision maker is. So that person who would make healthcare decisions, and that's just healthcare decisions, for you in the event you're mentally incapable of making them for yourself, and having conversations with them. So crucial, right? So that you're having conversations with them and your loved ones about what's important to you, so that they can help also guide that individual if in the event you're unable to speak for yourself. So if I left here today, I got into a car accident, who is my substitute decision maker? Who would be able to be my voice? And does my family all know what's important to me, right? And both of these things should happen long before there's a crisis. So long before there's a healthcare crisis or something that's, catapulted this discussion. So we don't want to have these conversations at a time when, everyone is emotional and there's crisis. It's really important that we try to have these conversations when we're well and when we're, of sound mind and body, and we can make these decisions based on our best interests so that we can help guide that person who's going to make those decisions for us in the event, and only in the event, we're unable to speak for ourselves. So you might be asking who your substitute decision maker is. Well, if you don't know who that is, and often I hear when we go into the hospital is the first thing we're asked is, who is your next of kin? Now, your next of kin can be someone, who you live with. It could be someone who you're close to. It could be anybody really that has, for some of our northern remote communities, it could be someone who has the phone, right? So it's really about identifying who is your substitute decision maker, because they don't ask that when we go into healthcare. Now, if we look at this hierarchy in Ontario, and now I want you to know that across legislations, again, across Canada, that hierarchy might change a little bit. But in Ontario, this hierarchy would help us decide who is our automatic substitute decision maker. So if you look in the yellow, those are court-appointed or legally appointed substitute decision makers. So for any reason that I look down in the green and don't have anybody that would meet that criteria in the green, or say I don't trust that person who's in the green, and I wanted to appoint a power of attorney for personal care through a document, but it's a very simple document that you can fill out. You don't need a lawyer for, and you would fill this document out and you would identify who would you want as your substitute decision maker. So they would be your power of attorney for personal care. Now, saying that you go down, and this is where I want you to think about who is my substitute decision maker. So in the green, those are your automatic substitute decision makers. And now a spouse or partner is anyone who you've lived with the last year. It does not have to be a sexual relationship. It can be anyone that you've lived with for the last year that is a relationship of significant importance. So if that is, for instance, my mother has lived with me for the past 10 years. So I have no spouse or partner, but technically my mom would be my partner because we've lived together for numerous years. And so she's automatically my substitute decision maker. Now, saying that, I have children, right? My child would also be my substitute decision maker, but knowing that my mom does not want to make those decisions for me, that my mom is also very ill and she would not be able to make those decisions in a timely fashion. I have appointed a power of attorney for personal care who trumps everybody in the green. So this way it just makes it clear for my healthcare provider so that, in the time that they have to make a decision for me because I'm not able to speak for myself, that they would have someone identified as my power of attorney for personal care. And the only reason why I did that is because it gets a little confusing with me because of my partner situation and my child. So if you have a spouse, that person would be your automatic substitute decision maker. And if you can see that in the green. Now, if you don't have a spouse or a partner, then it goes to your parents or children. So if you had parents alive and your children alive, that's where it can get a little dicey. And you might want to identify that power of attorney for personal care. But there are families, and I've seen this in many families, that, the children just automatically assume that role. And, the one child has been taking care of everything and the family is okay with that. But if you had multiple children, say you have 2 or more children, and say there was, some discrepancy over, would those children make a decision based on your best interest in a timely fashion? Because all the children would have to agree to a treatment. So if a healthcare provider is asking all 3 children or 2 or more children, what would your mom want? And those 2 or more children have different ideas, and there's no decision until they can all agree. So that's where it can get really, really complicated for healthcare providers who have to make decisions in a timely fashion. This Hierarchy and Substitute Decision Maker Act came into effect in 1996. And the reason for it was because they needed healthcare providers a way to identify a person, in the event you're not able to speak for yourself, who would that person be? So this is a way that they can identify a person to make those healthcare decisions, right? But they really want to respect the autonomy of every individual. So they ask that you have conversations with that substitute decision maker so that your voice is being heard at this time, even when you're not able to speak for yourself. Your wishes and what you want are valued at that time. And so if you had multiple children who didn't agree, that's where it can get complicated, right? That's where you need to have those conversations. Are all your children on the same page? Would they make a decision together? Or would you have to identify a power of attorney for personal care? And again, it's a very simple document and easily to fill out. And if there's any questions about that, I'd be happy to help in that area. And then, that goes to the parents with right of access. So it could be, through CAS, it's who has right and access to that child. And then it could go to siblings. So I think of my mother who had 13 siblings. Now for her, right, if she had no children, all of her 13 siblings would have to agree. That's almost impossible. That's where, again, you'd want to identify that power of attorney for personal care. And then any other relative. So say I had no relatives here, no one under that green, right? And it gets down to the bottom here. And now they need to, again, I leave here today. There's no one here. I have no one, available to make that decision. I get into a car accident and now they're reaching out to my Uncle Bob in Nova Scotia. because he's my only other relative. And I've seen how healthcare providers will do this. So they will go out and above to find out who that person is. They are legally obligated, you know, to find out who your person is. So if I don't identify him, right, and we know that there's already a stress on the system, this is a great way to help alleviate a little bit of that time and that stress on the system, on healthcare, because we can identify who, you know, who that person is, who they need to talk to. So for myself, right, I was able to identify who I needed as my power of attorney for personal care, because in the substitute decision maker, the automatic ones, there was some complication there, right? So I was able to create that document. I gave a copy to my appointed power of attorney for personal care and to my healthcare provider, and I keep a copy at home. And I've had multiple conversations with everybody that would be involved in that. Even my mom, even though I know she said she didn't want to make those decisions, I was able to help, you know, have conversations with her. And it was also a way for us to open up a lot of conversations, because I made some assumptions on what she would want as well. My mother was very badly burnt in a fire when she was 14 years old. And I just automatically assumed, you know, because of our conversations and going over through the years, she had said, you know, I will jump out of a building before getting burnt in a fire again. So I just assumed that she wouldn't want to be cremated. But the fact is that when we started talking about this and started having conversations, it came up that she did not want to be buried and that she wanted to be cremated. Even though I know it sounds like, you know, these are really hard conversations to have, and it was, I'm not going to say that it wasn't. I'm not going to lessen that grief that I'm going to feel when she dies, but it has helped me wrap my mind around it. And she has given me gifts by telling me what's important to her, and even filling out the Don't Duck the Conversation book with my mom, right? Going through, even just reminiscing about all those things that, you know, her, where she went to school, and those people that are important to her, and what's important to her in life. So if we think about what the requirements to act as an SDM is, it's important that you know, we're recognizing who's capable. If you're not deemed mentally incapable of making your healthcare decisions, the healthcare provider must turn to your SDM. So for any reason you're not deemed capable, right? They would turn to your SDM. But however, they also have to make sure that the SDM, so that your substitute decision maker, also has capacity to make those decisions as well. A person needs to be at least 16 years of age in Ontario to be a substitute decision maker. So you can appoint a power of attorney for personal care as well, as long as they are 16 years of age and above. But for the power of attorney, so for financial decisions, they have to be at least 18 years old. They cannot be court ordered to be a substitute decision maker. The substitute decision maker also needs to be available. This is very important. So when you're thinking of, you know, if I'm going to appoint someone to be my automatic substitute decision maker, are they available? Can I trust them? Are they available? You know, now they could live across the world, still be your substitute decision maker. So, but would they be available in a timely fashion to identify what's important to you, right? And nobody can be forced to be a substitute decision maker. So, you know, if I was identified on that list as my mom's automatic substitute decision maker, I don't have to be. I can choose to refuse. Sometimes for people, they might say, you know what, I'm not available and I have to refuse to be your substitute decision maker because it's just too emotionally taxing for me, right? They have a right to say that. In Ontario, to act as a substitute decision maker, you cannot be in a paid profession and giving support to that person. So, you know, I can't be your social worker and be your substitute decision maker. I can't be your landlord and be your substitute decision maker. So, you know, just being mindful of that you're not paying the person that you're asking to be your substitute decision maker. And we think about why it's so important to talk about advanced care planning. The research has shown that if you have expressed your wishes in advance, you're more likely to have your end of life wishes known and followed. And I also have seen how the benefits of this can really alleviate stress and anxiety and guilt for families and loved ones who just are not sure, right? I don't know what she would have wanted. I'm not sure what if I'm following his best interest. Your family members will have less stress and anxiety because they know your wishes. I cannot say that enough. It puts everybody on the same page and helps everybody makes a decision in a timely fashion. And and they feel less guilt because they understand what you wanted. And you will be more satisfied with your care, as will your family and your substitute decision maker. You will have a better quality end of life and death. But often, and in many illnesses, that doesn't happen that way. The sooner the better. And I think even before a serious illness, right? And what is advanced care planning not? So if we think about what it's not about just that one conversation, right? About one treatment. It should be about several conversations or even more. It should be, allowing us time to think and process and consider options. And are we getting all that informed consent, right? Are we getting all those treatment options? Are we getting all the information that we need to make informed decisions? This process really should allow for time for gathering and having conversations over time, because as we grow and as we evolve, even if we're going through a serious illness, our values and our beliefs and our wishes are going to change. So, are we again at the same place we were 6 months ago? Probably not, right? So that's where it's really important to continue to have conversations. And again, they don't have to be these formal sit down, let's have an hour conversation. It can be, I've seen this on the news today. What do you think? If that happened to me, this is what I'd want, right? Those are ways you can inform your people. It's not a consent to treatment. And I want to say this, often I'll see it as a consent to treatment or being used as a consent to treatment. It is not. At the time of treatment, a healthcare provider needs to get consent from the person that can give consent. So that's either from yourself, if you're capable, or from your substitute decision maker, if you're not capable, right? So a consent to treatment, you can consent for or refuse a treatment at any time. Advanced care planning is really about, understanding your wishes so that they can guide people to give consent. So at the time of treatment, that's where they have to ask a person for consent, not a paper, right? Or something that you signed 6 months ago going into an agency. It's not strictly a refusal of medical treatment. So your express wishes can and should include what you wouldn't want, what you'd want. Say 6 months ago you didn't want CPR, but now you do, right? Again, that's where it's not a consent to treatment. It's, again, having those conversations. And it's not just a document or a check form to be completed. So often, people don't understand that advanced care planning is just that. It's conversations, it's a process, it's a continued evolution of conversations. If we think about level of care forms in the hospital, those are not consent or refusal of treatment and should not be used or interpreted as such. So, I hope that that's something you can take away from this presentation today, is that it's not, this checklist or this form to be completed. It's advanced care planning is about conversations. And advanced care planning in Ontario, think about those things that hopefully you're able to take away from today. Record who your substitute decision maker is so that people know. So in my wallet, I have a little card that I have filled out that identifies who my substitute decision maker is. So, and it's right behind my health card. So again, if I got into that accident today, they could look at that card and they would know automatically who my substitute decision maker is. And, in Ontario, we don't have to have these written formal documents. These are really about sharing these wishes with individuals. You can write them down for sure. And that's not a bad thing, but, always making sure that you're evolving and looking at those wishes. If you write them down over time, right? Because as we know, things may change, at any given minute, and especially if we're experiencing a life-limiting illness. So here, these booklets, they are helping, educate in schools and workplace, really around grief and bereavement in the workplace. But, throughout my professional and personal life, I've witnessed how relevant and needed these conversations are. Normalizing death and dying and bereavement have become key factors and directly impact the process of individuals and their loved ones when they die. Having these conversations while healthy, and I can't say that enough, while healthy is optimal, as having these conversations at the time of a health crisis is not the optimal place to have such discussions. And people can be so emotional and stressed and hypersensitive during this time. So this is where this booklet can be a great little conversation piece, right? And starting those conversations. But do it while you're healthy and at the time when, you can have conversations with your loved ones in a healthy and compassionate way. And here's our contact information for myself and for Kathleen. If you're looking for any information on the Don't Duck the Conversation booklets, please reach out to Kathleen. And if you're looking for some more information on advanced care planning or healthcare consent, you can definitely reach out to myself.